Like I said, the case studies, the correlational studies that we looked at and the experimental studies can be done either at one point in time, or they can actually be done over and over in a repeated way, measuring this at different time points on the same individuals. I will really not belabor this point, but I just wanted to show how there are differences and strengths between longitudinal studies. But I want us to bring, especially with respect to mental health, the approach on what we call high-risk longitudinal methods in mental health research. And in this case, it starts with screening individuals who could be at higher risk, probable cases for mental health, and measuring certain outcomes or certain attributes over time to get longitudinal structure to the data obtained from this individual. So although longitudinal is a bigger name that talks about studies on individuals or participants over time and can actually help us isolate cause to effect for studies on outcomes like mental health, perhaps an approach like high-risk longitudinal method, where individuals are initially screened, although we know such conditions are transient and can happen to different individuals at different times. But for whichever cohort you could be interested in, could be screened at baseline and followed over time, especially among the so-called high-risk participants, and being able to identify the outcome later. Of course, ethically, if you would just be doing that as an observation study, there are other conversations around that, but that is outside the remit or outside the scope of today's module. There are all those considerations when designing these studies.